Today we're going to talk about concussions and concussion information, concussion awareness, as well as peak performance and why it's so important with young athletes. Now, over the years, in my 20 years, I've worked with a lot of athletes that have been concussed, both boys and girls. And today this topic is always relevant, but it's even more relevant this week for me because I just recently had an existing client who's been a long-term client come back in with concussion. Now, the significance of Matt is, as he came in, is I had just seen him in the fall for another concussion. So this is now his second concussion. So again, we want to create an awareness of what concussions are and why it's so important to have a good awareness of how they happen and what we need to do to actually help treat them. So one of the things I want to kind of give a comparison is because a lot of people don't understand what a concussion is. But I'm going to put it in a reference with what some and most people understand, and that's whiplash. So a lot of times, and most people, if they don't know anybody who's had a concussion, they know more than likely have known somebody who's sustained a whiplash, maybe from a car accident. So put them into perspective. A whiplash, when you have a whiplash, we're talking about anywhere between 4 to 10 G's of force to sustain a whiplash. Now with concussion, we're about 10 times that force. So anywhere between 60 to 90 G's of force. Now again, that is with a 9-0, okay? So we're talking about a greater force, 10 times that force. So as we look at those comparatively, if somebody has a concussion, they've obviously sustained whiplash as a result of that because you can't have one without the other. And these are all statistics that we have here in the Journal of Pediatrics. So again, some of the stats on concussions. Typically what we see is 1 in 5 high school athletes experience a concussion at some point. 33% occur at practice. Most of the time we think it's only going to happen in the big game, but they actually occur in practice. Twice as many concussions are occurring in high school than at the college level. So again, high school, and even we're going to talk about the growing demographics of where these are happening and the sports that they're being affected by. 5 million concussions are happening in the U.S. with the highest growth rate in middle school, okay? So it's not just the high schoolers, it's the middle schoolers where we're really seeing it. This is the big statistic right here, is that we're seeing 70% of high schooler athletes are still playing despite having symptoms of a concussion. And this is the thing that we really want to work on, okay, and creating awareness around. So again, with concussions, we overall lack, I'm going to say a good universal definition of what a concussion is. And a lot of times, we haven't seen some good directive measures that go about with diagnosis, how to diagnose it, as well as the recovery. Again, there's been some fragmentation in healthcare over the years. I think we're really starting to wake up to it, and then what we need to do to start to treat these kids and help to get them the results and the help that they need. And again, there's also very limited data to guide when to return back to play. Because ultimately, both the athlete, is wanting to get back into the game. They're wanting to get back in there and play. They're willing to, sacrifice themselves a little bit. And sometimes the parents are really wanting the kids to get back into play. But again, we want to, as healthcare providers, let them understand the ramifications of what is at play if they get back to play too soon. So again, let's talk about the two different types of concussions. We have two different types of concussions, and most people aren't aware of that. We have impact and impulse. So with an impact, that's the one that most people can think of. A push, a shove, a fall, a collision. Those are impact collisions. Just think about like an impact with a car, hit, okay? The impulse is unique. An impulse concussion is one where there's going to be some form of a hit, but what we typically see is a rapid deceleration of the body. So what that happens is sometimes the body is moving at a fast rate of speed and something happens that creates the body to stop, but the body is still moving. So that momentum actually creates the traction through the whole spinal cord, and it typically happens with a hit to the hip that actually travels along the whole spinal column going up to the brain. I call it, it's like at the carnival, the hammer and the bell. ringing the bell. You know, you hit the bell or hit the hammer and the bell goes up and gets rung. And that's the same thing what happens with an impulse. So that whole traction happens along the spinal cord, resulting in the concussion. A lot of times those impulse concussions can look like, oh my gosh, what happened? And that person just went flat on the ground. So we talk about what happens as a result of these concussions, any one of them, impact or impulse, is we see somatic effects. Those are things like they may have visual disturbances, they may have shortness of breath, they may start to see tachycardia, they may start to experience nausea, upset stomach, sensitivity to light, sensitivity to sound. Those are somatic responses. Cognitive, also just definitely not understanding maybe who they are, where they are, just being, you know, really shooken up. That's typical, you know, what we're going to see. It's going to be affecting a lot of different things of how they respond effectively, but it's also, we see that it's going to be affecting their sleep. You know, as we see here in the data, less than 10% of all concussions result in a loss of consciousness. So just because somebody doesn't black out doesn't necessarily mean that they have not been concussed. So typically with the AMA, you know, we see some marginal, some contraindications, or some things that we want to be aware of. Now, a lot of times the symptoms, or excuse me, the medications that they may be giving for concussions may be used to treat symptoms. And this is where, you know, again, we want to be aware of what's going on and have a good awareness. And we want to, you know, again, avoid any meds that may be declining the symptoms or altering their mental status. Again, all NSAIDs, so that would be ibuprofen, aspirin, acetaminophen, Aleve, any of those things that you're going to get over the counter, we need to avoid or be used cautiously, because they can cause their blood thinner and they can cause intracranial bleeding, and we don't want to have a brain bleed. You know, again, with a concussion, we do have a brain that is somewhat bleeding or hemorrhaging, so we want to be aware of that. Again, with the medications that are typically prescribed, you know, we're seeing things like amitriptyline, gabapentin, and topiramate, which are being used for migraines. And again, some of the side effects of these drugs are going to cause drowsiness, headaches, cognitive problems. So they're going to create some of these symptoms that that the person's already experiencing, and, you know, creating difficulty in speech and trouble with breathing. So again, ultimately, the athlete wants to get back to playing. That's the big thing. And we want to do it safely. We want to have a good understanding and creating a good protocol with that. So again, what we need to understand is that when they return to play too soon, typically we're going to see that the athlete is going to have a 3.5 or 3.7 times greater likelihood of either an ACL or a meniscus tear in their knee, because what we see is their righting reflex, which is a neurological reflex that our eyes focus on the horizon, is wronging them. It's creating a mismatch with their body, not understanding where they are spatially or how they're orienting. They also have a risk of a Tommy John syndrome, you know, with the elbow, where if they're into throwing sports or doing stuff like that, they're going to have laxity and possibly a tear of those ligaments right through there. They also may have false diagnosis of autoimmune diseases as a result of leaky gut and an imbalance between the brain and axis, and that gut-brain connection right through there. We're also going to see different muscles that are going to create these different adhesions and tightness throughout their body. The other thing we're going to see is they're more likely to come up with a second concussion, and what we call concussion roulette. This is kind of like our client Matt. So again, we want to address these injuries before they become concussion roulette, because again, the more that we play or we don't have a good protocol with what we need to do about re-entering back into the playing field, we're opening our Pandora's box up for this. But it's not just these issues and some of these health issues that we're talking about. It actually has bigger impacts on other things, especially as the student. So again, some of these studies right through here is typically, we're going to see that most kids, again, if they're occurring in practice, when we see the data of 33% that are actually occurring at practice, most of the time we're going to see that concussions are underreported. We're going to say 1 out of every 10, is being only reported by these kids, because a lot of times, if a coach doesn't see it, then it didn't happen. So again, sometimes the kids aren't aware of it till maybe the next day. Go, wow, I got hit, but I didn't think it was that hard. and maybe they say something to mom and dad, or maybe they'll say it to their coach, or maybe they won't, or maybe they'll just kind of brush it off as what happened. So the other thing that we're seeing is, that these can have lasting effects and damage to the brain, cognitive effects, and actually impact them in many different ways. The other thing that we're seeing is that they're going to have difficulties with school. They're going to have leading to poor grades and many different things. So again, they're going to have a hard time focusing. So again, we're affecting this cognitive behavior and cognitive function and their developmental processes and all of that. So again, the big thing here, again, of returning back to play is we want to create a baseline, and we need to do that. And we need to recalibrate and understand where these athletes were pre-accident so we can bring them back to that position following an event, a concussive event, and making sure that their riding reflex is working. We want to work with addressing any gut issues. We want to work with retraining their eyes, helping their spatial orientation, helping to restore their brain functions so their brain is working properly with all synapses, helping to all parts of their body so it's aware and connected, and helping to retrain many of the reflexes that get altered with a concussion. So again, just merely having a concussion test or doing the testing, is not necessarily going to be a panacea. It's not necessarily going to help correct the problem. We still have to go through the work of rehabilitating and helping with these clients post-concussion. So one of the things here we're talking about is impact test. Now this is one of the more popular tests that's being done as a baseline test. And here, this study right here, we're seeing that this was actually done at the University of Texas, and they're talking about the inner reliability. And they're finding that, the data shows that sometimes even these impact tests or these baseline tests are not reliable. So we need to have good baseline testing, but we need to use different systems and have always up to date and being looking for better tools to actually create these baselines. So again, our goal here is to end the ambiguity. We want to create these wellness exams where you're actually creating the baseline beforehand, coming up with proper exercise, nutrition for the athletes, working on correcting the injuries, and all the compensations of how their body may be adapting post-concussion or even beforehand, as well as supporting them through the entire season. And then also looking at, comparing the head injuries that they may have to baselines and what we need to do that. We have to have some good objective data, not just basing it on subjectivity, like, hey, how do you feel today? Because sometimes they may feel good, but if we're still having neurological imbalances, that's going to create problems. So again, here's some studies that talk about cervical spine and how cervical spine adjustments can actually alter the sensory motor and integration and how that actually helps things. We're talking about cerebral metabolic changes after chiropractic spinal manipulation and the manipulation of dysfunctional spinal joints, meaning cervical bones that are out of place and how it affects the sensory motor system of integration of the brain. So this is where chiropractic can really help these folks and really make a big difference. So again, I just want to introduce myself. I'm Dr. Sweeney, and I've been a NUCA chiropractor here in Austin for 20 years, and we practice the NUCA method, which is a very unique chiropractic method where we don't do any twisting, popping, and cracking. And what's so unique about it is we do a very careful assessment where we get a good history, we assess, we do 3D x-rays where we take very specific x-rays to 3D model what's going on with the spine and having a good understanding of how the spine's breaking down, what we need to do to actually help to restore that, but then addressing all the other effects of how this can be impacting the somatic responses that we talked about, the nauseousness, the difficulty with breathing, the cognitive effects. A lot of different aspects here, as well as the reflexes of helping the body and the brain to work much better. Again, we're doing this without any traditional twisting, popping, and cracking. We've worked with all kinds of folks with different spine injuries, shoulder problems, carpal tunnel issues. And again, we do these well checks. We do pre and post concussion assessments and also making those recommendations. So again, what we want to do is help make a difference for these kids today and help them to return back to play in a safe and effective and efficient manner. So if we can be assistance, contact our office. We'd love to hear from you. Until then, farewell, be well, and be grateful.